A lot of times when patients come in seeking some sort of treatment around the eyes, a lot of them are not really thinking about a forehead lift or a brow lift. What they're usually talking about is sagginess of the eyes, maybe deeper frown lines. They're not really thinking it's the eyebrow that is the problem. But one of the important things that happens as we get older, not only does our skin sag and becomes loose, but it's also the structures of our face that overall sags, and that includes the eyebrow. So as we get older, our eyebrow starts kind of descending down. And we want that eyebrow to be certainly higher than where the bony edge of the orbit is. But in some patients, that eyebrow that used to be higher sort of drops down. And so when that area sort of drops down, the space between the eyebrow and the eyes becomes more narrower, and it also leads to the heaviness of the upper eyelid area. The other thing that happens, which is a kind of a hallmark of brow ptosis, which means eyebrow dropping, is what we call lateral hooding, which means that the end of the eyes, it starts sagging, and a horizontal line across the bridge of the nose that also occurs, especially when the central part of the forehead and the brow descends down. So all of that leads to the patient looking more stressed and not as relaxed and rejuvenated. And so a brow lift for a lot of people is about addressing these type of problems.